From KETK News, you're watching East Texas Live.
Welcome back to East Texas Live. Joining me now, this is Dr. I just said it, Sheldon Freeberg. There we go. And he's joining me today. He's with CHRISTUS Heart Hospital, and he's here to talk a little bit about the importance of heart health. Now, thank you very much for coming in.
Sure, no problem. No problem. Happy to be here.
Thank you. And then I just want to get started off with February. February is Heart Month. Can you tell us a little bit about this and why it's important for people here in East Texas?
Yeah, so Heart Month is really designed to raise awareness to not only heart disease but valve disease as well. And we know that in this community there's quite a bit of heart disease, and it's important to kind of make sure that we're getting that checked out, you know, as we get older.
Awesome. Now, specifically, tomorrow is Heart Valve Disease Day, right?
That's right, yeah.
Heart
Valve Disease Day, yeah. So it turns out that there are 1.5 million people in the United States that are walking around with a bad valve, and that's kind of hard to believe. And there's 250,000 of those patients that die from aortic valve stenosis in a year. So there's a high percentage of patients that have that problem. And so we know that as we age, you're more at risk to have a valve problem. So we like to say if you have birthdays, and the more you have, you might be having a valve problem too. So.
Yeah. So who is more at risk of heart valve disease?
So as we get older, heart valve disease goes up. So generally the elderly or patients that are older than the age of 70. Sometimes it can be a congenital problem, in which case it'll affect patients that are younger. But at Mother Francis, we have a team dedicated to sorting out the valve and whether or not it needs to be addressed, and the best way to do that, or the options thereof. So.
Now, people listening, if they're like, oh, well, I didn't even know this was a big problem, and clearly it is, what are some of the signs that people should look for if this may be a problem that they're experiencing?
Yeah, so it'd be shortness of breath, chest pressure, trying to figure out what to watch on Netflix. No, that was a joke. but no, those are some signs that there's a valve problem. Yeah. And if you're short of breath getting up off the couch, you know, you might have a valve issue. So definitely check with your primary care doctor, or, you know, your cardiologist if you have one. Yeah. And try to determine if there is a bad valve.
Right. I was about to say, with that Netflix thing, I might be at risk.
Yeah,
to go and get that checked out.
Yeah.
Now, can you tell us, where can people go if they think maybe this is something, or maybe if they just want to be safe if they're older in age? How can people go about checking this?
Yeah, so we usually start off with just a physical exam. If we hear a murmur, a lot of times people say, I've had a murmur for many years. Then that's followed usually with an ultrasound. And then if there is a valve problem identified, then there's a battery of tests that we do to determine how severe a valve issue might be. And we have a team of physicians that specialize on, you know, in valve, sorting that out with your cardiologist and trying to figure out the best way, if you do have a problem, to get that fixed.
So definitely tomorrow for Heart Valve Disease Day.
That's right.
If you think this might be a problem, give them a call, make an appointment. But either way, as we're finishing up February with it being Heart Month.
That's right. That's right. Heart Month. Yes. Yeah. February.
Remember, there's so much going on in February. Yeah. Remember, it's Heart Month. Your health is incredibly important. Is there anything else that you think is important for our viewers to know about Heart Month, about staying heart healthy?
Yeah, I think it's just about raising awareness. It's never too late to get checked out. You know, if you're having any symptoms, or just for prevention, we like to see you sooner rather than later. So if you're having any exertional symptoms, you should definitely be evaluated by a medical professional. So.
All right. Well, thank you very much for
you're
coming
welcome.
on. Thanks for sharing all of this with us, and happy Heart Month.
All right, you too. Yeah, happy Heart Month.